we're a autologous stem cell therapy company that treats heart disease, critical limb ischemia, using stem cells that are generated from the patient's own blood. We have treated some 500 patients compassionately, and we have data on 245 patients for such diseases as angina, ischemic and dilated cardiomyopathy, and critical limb ischemia, with significant results. So, for example, in critical limb ischemia, the University of British Columbia and University of Toronto published that 83% of the patients that they followed for 4.5 years had saved their limb from otherwise certain amputation. That follows the results that we saw in Thailand, where 5 of 6 patients in the initial study saved their limb from amputation. And it follows the results that we achieved in Hungary in a 20-patient clinical trial, where 10 received ACP and 10 received a placebo. In the 10 who received ACP, there were no deaths, and 7 of 10 saved their limb from amputation. In the placebo arm, unfortunately, there were 2 deaths, and 6 of 8 lost their limb to amputation. In the angina trial, we had 24 patients who were suffering from the severe form of angina, and their results was that the majority of them had a whole class reduction in their angina. So if they had chest pain at rest, they went to a condition where they no longer had chest pain at rest. And so this is indicative of the power of using your own stem cells to treat diseases such as ischemia. Now, that's just the first stem cell lineage that we have. We have 2 other lineages. One is a neuronal cell precursor, and I'm working with Dr. Fraser Henderson from Maryland area. And he's a brain surgeon, and he did his PhD in this area, and we're designing a clinical trial to treat post-traumatic stress disorder as well as spinal cord injury. So that will be the neuronal cell precursor trial. And then we have the third lineage is a bone cell precursor. And as we age, we all lose our gum line. It recedes, and we get hot and cold sensitivity, for example, in the mouth. Well, the BCP lineage will be able to add a new layer of gum line and prevent and reduce nerve conditions such as the one I've described.
And obviously, you've surpassed very well the bulk of COVID. What are your key success factors?
So we were fortunate to be in a position that with COVID, we're doing a rescue of this company. It resulted in us raising $11 million since COVID began and doing a restart of the company. And the success factors there were really, because we were dispersed, because our team is based in Israel, based in New York, based in Vancouver, we were already using telemedia as a way to meet, and so we were able to come back together as a team. I drew many of the people that I worked with at the company during the first 5 years of the company's life, and brought them back together to reboot and restart the company.
What are your plans, Thomas, for the next 12 months?
So we're going to close out a phase 2 clinical trial in critical limb ischemia and finance the trials that I mentioned with respect to the heart, the nerve, and the bones, the BCP. So we are here to look for co-investors, essentially partners, who will co-invest with management who have completed the turnaround on the basis of approximately $30 million is the structure, where $3 million will go into the public company shares at a pre-money valuation of $16 million, and $9 million will go into each of 3 subsidiaries, where we will have the right to co-invest with the partner up to a maximum of $75 million in any 1 year to fund the development of these therapeutics and bring them to market.
And what brings you to Sir Anthony Ritossa's Monaco conference?
Well, I really want to commend you and the whole team. This is such a unique situation, for a CEO to come and a co-founder, quite frankly, to come to a conference and meet family office principals who, where I can start a relationship of trust and build that relationship of trust over the coming years, and do business together. It's obviously a very unique situation, and again, I want to commend you for completing it.